Dr. Rapaport, have to ask you about thickened skin as it relates to the topical steroid withdrawal process.
Um, there are inquiries that come through uh, via this protocol and other sites where patients say, I don't know what you're talking about, that this is over with in 3 to 5 years. I'm at 7 years, I'm at 8 years, I'm at 9 years. I still have RSS, red skin syndrome. And when I inquire and delve deeper in, or I see photos also, the acute red skin syndrome and the addiction is over with, and the withdrawal is over with. Most probably in that 3 to 5 year period, maybe a little couple extra months. What they're thinking they still have is the problem because they have thickened skin over their wrists, over their elbows, on their neck, the back of the neck, from years of scratching. It's a different diagnosis. It's the third diagnosis. It's called Lichen simplex chronicus from scratching. And that takes time and sunshine, and that goes away. None of the drugs work on that. Nothing, no lubricant, no bathing, nothing works but time and sunshine, and it all goes away. And that's the elephant skin you're mentioning.
What physiologically is happening that creates the elephant skin?
Well, take somebody who maybe is neurotic or maybe has some obsessive things, and they keep banging their hand against the wall. And sooner or later, they're going to get a big callus here. The trauma brings it on. Well, the trauma of scratching thickens the skin. And the thickened skin is itchy also, so it feeds upon itself, and the thickening will not go away until the scratching stops.
I resemble that remark, by the way.
Say it again?
I resemble that remark, by the way. So, sunlight.
Be patient. As long as the flares are gone, as long as the redness is gone, you're sleeping, your itching is down to a bare minimal, except in these thickened areas, you're going to be fine. If it's most places in the world, sooner or later, you're going to have springtime and summertime. Get out in the sun. Get out in the sun. I'm not a strong advocate, even though I used it years ago, of ultraviolet in the office, because I had control, I used it. But to refer you to outside offices, I'm always afraid you'll get burned or something bad will happen. I'd much rather the sunshine is our therapy.
At what point in the topical steroid withdrawal process is sunlight warranted? I mean, if you're in a full-blown flare and flaking, is...
No, at the beginning, forget it.
Okay.
It flares you, it blasts you out of the world. Heat and this ultraviolet will bombard your skin. You go negative. I do utilize ultraviolet as an anti-itch therapy later on when the redness is almost all gone, when their symptoms are markedly better, but they're still a little itchy. And it seems to solidify the cure by stopping the itch and making the skin, what's a good word, supple,
So
friendly. Again, the ultraviolet anti-inflammatory helps us.
So saying what you just said back to you, you're saying once you're markedly through the the topical steroid withdrawal, the sunlight is indicated for really solving that third diagnosis of thickened skin and get you over that last time.
Yeah, and if they don't have thickened skin, and if they're not itching very much, I don't push the ultraviolet. But they've already read about ultraviolet and that I've been an advocate, so I allow it to enter into the discussion as they're almost near complete with cure, to give them something more to do. And it's fun to send them on vacation and to compliment them and give them a prize for being such a trooper and being cured.
What do you mean being cured? Are they going to be cured?
They're cured. no red flares, nothing else, and the thickened skin will go away. Yeah, I've told people in Maine, in Europe, in the cold climates, I said, if I have to fly out there in the middle of December during a snowstorm, I'm going to be there. You're going to be cured. Don't worry. Don't worry about it.
Fantastic. All right. Please like, share, subscribe, because helping us with the algorithm really helps to get the word out. And boy, there's a lot of people suffering out there. Thank you, Dr. Marvin.